What's better? Should we do the facelift now and then in 15 years, or should we just do a ton of microwave therapies like Morpheus, Sculptra, microneedling, and try to push off the facelift as long as we can? I'm Dr. Chopra, board certified deep plane facelift expert. I love using non-surgical rejuvenation when it's appropriate, and the gold standard, of course, I love is deep plane facelift and neck lifting. And I want to dive into a concept that I hear a lot, but it really came up yesterday when I had two patients. One was a 70-year-old who'd had two facelifts in the past, wasn't a deep plane facelift, so she came to me one day after getting back from Burning Man Festival. The second patient also had a non-deep plane. She had a kind of a mini lift. After about 5 years, she was already back trying to get a facelift to achieve the results that she really wanted. And during surgery, it was really interesting to me, and I thought of this idea for a video because it was actually such a beautiful dissection. It felt like I was doing a facelift on them for the very first time. And the feeling of the tissues, the way they responded, the way they held the suture was far better than what I encounter when I have patients who come to me after years and years of Morpheus, microneedling, Sculptra, all sorts of microwave therapies in their face. It creates scar tissue and really does make the dissection more challenging. And I believe it can even weaken the SMAS. So when I put the sutures in to suspend, it can cheese wire through. Maybe it doesn't hold as long term. I want to talk about the risks and benefits and when you should choose non-surgical and when you should maybe consider an early preventative deep plane in your 40s or 50s. So fillers can be great if you've got deflation in the lips, the mid-cheek, or pre-jowl sulcus. But if you're using it to try to compensate for too much excess skin, that's when you're going to get that full stung by a bee appearance, that masculinized appearance, and over time it really starts to look unnatural. So if you are considering a facelift, you're trying to figure out the math on like, should I do a facelift now and again in 20 years, or should I just push it off and try a bunch of other treatments? Let's set up a consultation, send us your photos, age, height, weight, and let's talk about your unique case, and I'll propose the right treatment plan. I can propose non-surgical or surgical.